and welcome to another edition of the Health Talk on Premif Academy. Today, we are honored to host a Senior Psychiatric Nurse at the University of Port Harcourt Teaching Hospital, Mrs. Izegbuwa Otokon. She will be shedding light on a very important topic, depression, understanding it, and overcoming it. In this session, she will help us to understand what it truly means for someone to be depressed, the key signs and symptoms that we should watch out for, the practical habits that can support emotional well-being, to seek professional help in cases of clinical depression. This promises to be an enlightening and impactful conversation. If you are ready, I'm ready. Let's begin.
Let's start from the beginning. Many people, when they hear about depression, they might not understand what depression is. So, in very simple terms, what exactly is depression?
Depression is feeling unhappy, layman language. But depression, in a broader way, is an affective disorder. Affects our mood, affects our behavior, affects our thinking. It's an affective disorder that brings about retardation in our psychomotor activities. Psychomotor activities like your movements, in your behavior, in your thoughts. You understand? So everything will just be retarded, going down. Yeah? The persistent feeling of unhappiness. But it can occur any time of the day. It's not it's in the morning. You can wake up in the morning and be happy, but maybe at noon, sadness can occur. Or sometimes it happens at night. It still will be persistent at a particular time. You understand? So when you observe those kind of behavior or those kind of retardation in activities the person used to enjoy, and they're just reducing, so there's cause for alarm. A person needs a treatment.
Okay. So let's talk more about the difference between sadness and depression. Can you throw more light on the difference between sadness and depression?
Yes, sadness. I lost a child, can be sad. I went for a promotion exam. I was not promoted, and I know that I did better. I can be sad. Some undue sadness that one cannot actually elucidate what is causing that sadness, and it has lingered for long. So since we can term it as depression.
Sadness that is lingered for a very long period. Okay. Sometimes people who are depressed don't even realize it, and people that are living around them don't even know. So what are some of the signs and symptoms that we can watch out for to know that somebody is passing through depression?
There are various signs and symptoms you will see. Let's use a child that loves music. When depression sets in, you see that love for that music, you say the pleasurable activities they used to enjoy, they will no more enjoy it. There are some persons that love to go to party. They don't want to hear party. Before you even invite them, they are already dressed for the party. But when you see that person passing through depression, you call the person, my guy, there is no interest. So that is a sign.
Loss of interest.
Loss of interest in pleasurable activities. Undue weakness. And just wake up in the morning. He has slept all through the night too. You are talking to her, I'm feeling weak. You just woke up from sleep, because they are sleeping, but their mind is not sleeping. If the body is asleep, but the mind is working. You understand? Because of sadness or depression. Loss of appetite. Some persons, when they are depressed, they eat more. I use myself. When I'm not happy, that is when I eat foolishly. If you let me, just see me eating voracious, I just anything I say, I just want to eat. I know that I'm not happy. But there are some persons, when they are not happy, They don't want to eat because as far as anything in the environment does not interest them anymore, even to food, they will not be happy. Why some persons too, you see them, they'll be losing weight. Somebody that's not eating will be losing weight. Why some will be adding, like my own type, I will be adding. You say, you will enjoy. You don't know, I'm using cloth to cover this thing, so it's not enjoyment. It's me that know what is going on in the system. I said, I tell you. So there will be loss of weight. Some persons can just be angry, undue anger. The thing you can just say, see your head. Normally we just laugh, saying, I saw your own business. But that little thing, you just trigger the anger in them. They'll just you like, but I've told you worse things before than this now. Why are you angry? You now say something they worry your head. You have triggered it more. And those are some of the signs you should see that I'm not sure this something may be wrong somewhere. But in our society now, we don't care. So that is it. Because the society don't care. That is why we don't see those signs. The signs are there. You will be seeing it, but because you don't care what the other person is going through, so you just I beg, you just go on. Like what I was telling you about my daughter, we never knew she was going through that emotional trauma because of school. But the dad just felt that you don't read. Every time you're always on phone. So how do you think you will pass your physiology? So if not the elder sister that now said that is no. Anytime she's on phone, she's reading with her phone now. Do you think it's every time we play with phone? And God have dedicated her that when the second semester, because that was first semester, when the second semester result came out, she got an A. So the dad now called a friend that see, when they now check, they now saw that she even passed it, but they did what they did. Know some of these lecturers what they do in school. So the signs are there. Just that we close our eyes not to see. At times he said, if I ask her now, maybe if na money now, maybe some people that are having financial difficulty, if na money or they ask me money, I beg, I don't want to. So we know we just decide to ignore. The signs, we see them. We see it every day in our children, in the church, in the society where we live. We see the signs. Somebody giving birth to just female, he will not be happy. Have somebody give birth, she has a son, but she needed another son. So as she just gave birth, she had another female, making it 4. She came home. The day she came home, all her herself, they got a touch of the anger.
Transfer the aggression.
You see it. Bah. So I was just there, I was watching them. This one will come down. We talk. I said, what is it? I beg you, nobody asked me about no. Yes. They don't know what she was going through. The woman is going through depression. But the people around her don't understand that she's depressed. And that is why the only way she can vent and take care of that baby is for her to vent that anger on anybody she sees. So that is some of the common signs you can see. Whether it's depressed.
Let's talk about what leads to depression. What are some of the common triggers and the causes of depression?
Let's put it under biological factors. We have environmental factors, and there's let me say physical factors. The biological hormonal changes. Some adolescents approaching menarche is the beginning of measures. They can be depressed, body changes. You understand? While menopausal women, body changes can lead to depression when there's no proper awareness. You understand? Can lead to, because of those hormonal changes, can lead to depression. Then we also have some psychological causes. Psychological causes are those things that affect our emotions. Loss of loved ones, loss of a job, failure in an exam, not able to meet life challenges. You understand? That is how will I put it now? Your aspirations in life, not able to meet those targets you have already planned, can lead to depression. The age of marriage, not getting married, can lead to depression. Married, not having a child, can lead to depression. Some persons married, then the man will say, since I married you, everything about me start going down. The woman will say, everything about me start going down. Can lead to depression. Then academic, school, not meeting up academically, can lead to depression. Choice of career, you understand? I want to study medicine, but I ended up studying law. Can lead to depression because that's not my choice. You understand? Then environment, the economic of Nigeria today, or even of the world, is hard. It's harsh. Can lead to depression. Some persons cannot feed even a meal, not just 2 square now, a meal. You can be depressed. You have children, they are crying, I'm hungry, I'm this, you can't afford it. Those economical factors can lead to depression. Then, not able to pay your bills. People see that you are a graduate, you are still dependent on your parents. Somebody can be depressed. You understand? The environment, not you have accommodation issue, landlord gave you quick notice, no fund anywhere, can lead to depression. Then there's illness, those are physical. You are sick, no money for medications, and the sickness they told you is terminal, that you will have to live with it. I have a patient presently, that is what is causing her depression. She was addicted to pentazocine as a result of menstrual pain, dysmenorrhea. So since she was 13, she started menstruating. She's 19, she has been on painkillers. Now she became addicted to it, and which have also caused a lot of damages. As she came, they said let's do scan. They saw she have other gynecological procedure, and the gynecologist came and said the only solution to this your problem is for us to remove your womb. And she's just 19. So what will she do? The mom was crying. He said, it's to remove your womb. The girl said, instead of you to remove my womb, I better die. How will I be alive and not have a womb? I will not give birth. So the doctor said, just that you are a teenage girl, you are 19. That is why I'm just don't know what to do. That's why I'm a crossroad. But if you were like 30, or you have a child or 2, you just remove them. You don't need the womb. But now you are just a child. So the girl was crying. By the time they left, I told the woman, we have had it on the horse's mouth. So what will you do? The guys, when the thing starts, she'll be rolling on the floor. If it's 4 days, that 4 days she will not put anything in her mouth. Of ailments have led her now. She's so depressed. Illness can lead to depression.
Some people think that depression only affects adults or people of certain age. Who can be affected by depression?
Depression don't have age value. I'll give you an example of a 19 years old. We've had 13 years. We've had children these days get depressed. You'll be asking yourself, what did they depress this one? Yes. You ask yourself,
what are they thinking about?
So it's not only what they are thinking about, the environment too is affecting them. When you are in an abusive family, where your father always beats your mother, every time quarrel, when you wake up in the home, instead of good morning is either they curse you or they beat you. That kind of what do you expect? Children will grow up with depression because there's no love. You understand? Any child that grew up without love is bound to have depression because there's no love in the home. When you wake up in their house, the things are you stupid? Are you this? No, how are you, my love? You wake up, how was the night? Nothing like that. It's either the father is shouting at one end or the mother is the tigress at the other end. So those kind of things. So age does not tell now who gets depressed or not. Though this is said those days, but not no more. Say from 30 years and above. No. But I've given you some instances now where children go to school, just see a child withdrawn. Especially now that we are having advanced slavery. All these people live doing house help. They sleep. When you don't have proper sleep, you can get depressed. You sleep by 12 and your mother is expecting you to wake up by 4 to start the choice, and at the end of the day you still go back, you still go to school late. So all those kind of things can lead somebody to depression. So no age now as far as depression is concerned. Because if you just go out now to talk of depression, you see children giving you instances. I remember when I did it in the church, some children came out. That girl was in JS1. JS1 should be around 10 years. All these things, you sell these signs and symptoms, I'm going through it because if you want to tell my mommy something, tell you I'm tired, I want to sleep. You understand? My parents don't have time for me. So you see, that is why the society, a lot of our youth stay into drugs. Because for them to take off their mind off those things that are depressing them, their parents have introduced them into drugs. So depression have no age value.
So if someone suspects that they are depressed, what should they do?
Number one, speak out.
Speak out.
Speak out. Learn to know what is causing that. First of all, identify what is causing that depression. Then speak out. Don't keep it to yourself. Why most persons go into depression and end up with suicide is because they are afraid. If I tell them what I'm going through, some are ashamed. You understand? Ashamed to tell somebody that I've not eaten since morning. You understand? And I have not paid my school fees. They said I should not write the exam. And what will people say? What will people say? Even if you are still progressing, people will still talk about you. So why not speak out? So the only solution is speak out and seek help. Go for medical experts. Seek the help of a psychologist. So you can meet, you can go to counselors, go to your spiritual leaders and seek help. So that is the best solution. Speak out, seek help, then meet your spiritual leaders to guide you.
Beyond therapy or medicine, are there natural lifestyle that people can adopt in order to prevent or reduce depression?
Yes, in these days we talk about exercise. Tell people to resume exercise, whether aerobic exercise, any exercise, then eat well. You say we not be get food go chop, but when we were growing up, when we were in school those days, one of our lecturers used to tell us that it's not now again. Now 500 naira you can get a balanced diet. You don't need to eat cow head to get a balanced diet. With your small crayfish, eat vegetables, you can eat a balanced meal. You understand? Most people that go into depression, most of them are greedy. Always want to acquire. You understand? If what Mr. A is eating, you cannot afford it, but you can afford a meal of 2,000 naira, you have it, you eat it and you'll be happy. Eat well, rest, take enough rest. Some of us will just do this movement, morning till night, we don't rest. On business, we live a triangular life. And there's a triangular life. On Monday, I couldn't come to church. I came back from work by 7, a few minutes to 7. One pastor called me. I told pastor, don't think I can come to church today because my body needs rest. I've been in the office working up and down. The same thing, Tuesday I was in the inside vehicle, I was already sleeping. By the time I got home, I just on my phone, I saw the message. I said, no, today Our body does not need this stress. So all those triggers, stress, eat well, take enough rest, do exercise, and with God on your side, you can overcome depression.
Sometimes families, they want to help, but they don't know how. So how can people support a loved one battling depression?
It's the same to take them to a hospital if they know the signs and symptoms. You understand? Don't feel that the person is pretending. That is what our society always feel. The child wakes up in the morning, you are calling the child, is not answering you. Come tell me, say, I can't give you food today. We're always after our own comfort, but not after the comfort of the next person. Try to find out why this is my child, this is not you, this is not the person I know. Try to find out what is causing that quietness, undue quietness. Like my little boy Joseph, if he's not happy, I know. And he to his body, just tell him, Mommy, I'm not happy with you. I don't like what you did. I will not be your friend again. That is his way of expressing his own form of depression. I don't want to be your friend again. So you now find that, I usually tell you, you know me, I like friend. I want you to be my friend. You want me to die? You will now say, okay, Mommy, I'll be your friend. But see what you did, I don't like it. So, apart from that, parents too, as parents, guardians, we should be able to say sorry to these young ones when you should be able to know what, number one, identify what is causing that thing. Make your children, even your mates, your friends, so that when anything is happening around, they can be able to speak out. Like a child that was raped. There was a case presentation in my office yesterday. A child, she was raped, but nobody believed her story. And she was abused severally, sexually. So nobody believes her story. Because of that, she grew up having depression. Because the father also separated from the mother. Left her in the hand of the mother. The mother that would have been the one supporting her, listening to all her pains. The mother was turning to the people that assaulted her because they are the mother's relation. As your papa useless, this, that. So the girl now wanted a father figure. All his friends are me. He always make friends with me, and they are always assaulting her. So yesterday we were in the seminar, our HOD said, in that case, what are you supposed to do? He told the doctor, you have to make that girl your friend. You have collected her phone number. Every day call her, talk to her, say, if these people hate you, I'm your friend. I want to help you. That people have passed through this thing before and they were able to go through it. So let two of us go through it together in this journey. And you see, the person will just come out of that depression. You understand? Instead of leading to suicide, and easily come out of it. So it's for the parents or the guardian or the society. We should look at for those signs and help the person find out what is causing those depression.
Right now, someone watching might be feeling depressed and sad. So what will you say to that person?
Speak out. Look for things that will make you happy. Make yourself happy. Happiness is from the individual. Nobody can make you happy. You understand? And if you don't make yourself happy, I cannot make you happy. Because the things that make you happy are not the things that make me happy. So first of all, find what is making you happy. Go do that thing that makes you happy. When you try and the thing you see that is not coming, seek help. Meet a counselor. You understand? And seek help. Then you should choose circle of friends rightly. Don't meet friends that will tell you, and this is what I did. If that thing he did is drug, run. You understand? If it's drug that he was able to use to suppress his run. Because when that drug effect, whether it's alcohol or any substance, we off the system, that depression have not gone. Depression is sitting right in front of you. So run from anybody be it a man, a woman, a friend, even a parent that want to introduce you into drug, wrong. Because that is not the solution to depression. Depression, seek for those things that makes you happy. Speak out, look for a counselor, look for a psychologist, and meet a psychiatrist. Does not mean that you are mad, because that is why many people don't want to seek help. They feel, say make I go meet psychiatrist, that means I dey mad now. No, depression does not mean you are mad when you go and seek help. Because some persons too don't know what is even causing it, but with much interrogation, talking, you will now know that maybe this thing you talk now is what is causing my own, so you can get help from there.
Thank you very much, ma, for your time. Thank you for this opportunity to educate us and enlighten us on the topic of understanding depression and then overcoming it. So to my audience, to come your way again, subscribe to Premif Academy YouTube channel for more enlightening and educational videos. Thank you.
Thank you.